Hi, I'm Shashank Bhargav, and you're listening to Three Things, the Indian Express news show. The first outbreak of COVID-19, the disease caused by virus SARS-CoV-2, also called the novel coronavirus, was detected in Wuhan back in December 2019. It has now been more than 6 months since then. Globally, the total number of deaths due to the virus stand at more than 530,000 according to Johns Hopkins University. In India, the number of cases have crossed the 7 lakh mark and the death toll is now more than 20,000. During this time, a lot has changed about what we know about the virus and how we are dealing with it. So in this episode, we take stock of what all we have learned so far and how India has handled the pandemic. To understand this, we speak to epidemiologist, the president of the Public Health Foundation of India, and the member of ICMR's COVID-19 task force, Professor K Srinath Reddy. Dr. Reddy, it has now been over 6 months since the first case of the novel coronavirus was detected. And it has been more than 100 days since India first went under lockdown. How are we doing when it comes to slowing the spread of the virus and tackling this pandemic?
Well, I think the answer has to be given in different parts. How are we doing as a country and in different parts of the country? And how are we doing within the country in terms of over time what has evolved? And third, how are we doing in terms of international comparisons? I think in terms of how we are doing as a country, we have seen some of the larger cities and the surrounding districts fairly heavily affected in some of the containment zones. And while some of them are beginning to get controlled, others are still battling it out. However, it's also true that the virus has not spread with as much contamination across the country in different parts of India. There are several parts of India which have been very lightly touched by the virus. The smaller towns and cities, much of eastern India, other than Calcutta, rural India mostly, have been relatively unaffected. And even in the big cities, it's not a uniform pattern. Some of the containment zones are heavily affected. Some other parts of the city are not that much affected. So we are actually dealing with an epidemic with different calendars in different parts of the country. And therefore, there is both an urgent need to quell the epidemic where it is now fairly fiercely evident in some of the containment zones of large cities, but at the same time to protect the other areas from spread of the virus. Also, it is very clear that different states have done differently in terms of their ability to control. We have seen some states deal with much greater success than other states, partly because they focused a lot on public health efforts, not just on case management and hospitalization. Lastly, in comparison with other countries, we seem to have done much better than Western Europe or the United States or even parts of Latin America, and reasonably well in the company of our South Asian countries, who are our neighbors, because of several factors which may have favored us.
Okay, so if we are at different stages of the pandemic in different parts of the country, then would you say we require a more localized approach? We know that a lot of major decisions, say the lockdown, relaxing norms, or sealing of borders, come from the center. But how important is it to have more localized strategies?
It is absolutely necessary. Even from the very early stages on, there should have been far greater localized implementation effort, even if some of the planning was done nationally. I would say that the policy should have been set at the center, the planning should have been done at the state capital level, and the implementation with a great deal of flexibility should have been done at the district level with customization to the local conditions, including urban rural differences within the district. It is only then you can bring in local knowledge into action for finding locally relevant solutions. Even if the broader policy is fairly uniformly set at the central level in consultation with the states, you cannot have a pandemic being tackled, particularly when there is a differentiated calendar with a single approach. It's not a one size fits all.
And, one big centralized measure that was taken early on was, of course, the stringent lockdown. Do we now have a sense of just how much that was actually effective and whether or not, like some experts say, we should have done that a bit later?
Well, you cannot always judge retrospectively because you had to decide on the basis of what was the prevalent situation at that time, not only in terms of the appraisal of the state of the epidemic in India, but also the international scenario which was influencing our thought process. I would say that the first two stages of the lockdown, which were reasonably well enforced across the country, did bring about the results in terms of containing the spread of the virus and reducing some of the infection damage and the death rates. On the other hand, in the subsequent stages post the 3rd of May, we have seen considerable relaxation, which is probably necessary in order to regain some of the economic and social activities. But that actually enabled the virus to spread faster. And when our public health measures did not keep pace with that, our focus was still on how to raise hospital capacity rather than all the fundamental community based public health measures like symptom based syndromic surveillance of households, early case identification and testing of those cases and contacts, extensive contact tracing and isolation. These measures really did not match up. And therefore, we saw after the 3rd of May, the actual dynamics of disease transmission changing. And in June, we have seen that really rising to a higher level. So I believe it was in the beginning, the international scenario of multiple deaths happening in Europe and United States, and the fear of the pandemic, the preoccupation with ventilators, all of that sort of shaped the decision making. If we had delayed the lockdown, we do not know what exactly would have happened. Some people say that we could have actually gone in for a lockdown even earlier and prevented even some of the escalation that we are seeing now. It's difficult to second guess at this point in time. All I would say is that post the 3rd of May, we could have acted better in terms of public health measures, and we should have prepared for that even in the first two stages of the lockdown.
Dr. Reddy, in what way has our testing strategy changed during this time? And based on the way cases are rising right now, to what extent do you think there is a need to increase testing to get a better sense of the situation?
In the initial stages, when the lockdown was complete, the testing numbers were not that critical because of the simple reason that any potentially infected case, as well as the contacts of those cases, were all confined to homes because of the stringency of the lockdown. So there was sufficient time for the virus to be exhausted and expelled from the body. It was important to note who were actually infected, but their infecting other contacts would have been much less other than household contacts. As we were coming out of the lockdown, that the testing should have been ramped up. And knowing that there are both false positives and false negatives with the various tests, and particularly with the RT-PCR, there are plenty of false negatives, we should have actually also gone in for symptom-based syndromic surveillance based on the symptoms of COVID-19 and influenza-like illness through household visits by primary healthcare teams and citizen volunteers for early identification of suspect cases, their immediate referral for testing, either at home or in a facility, their isolation, and extensive contact tracing in order to contain the further spread of the infection. This is what states like Kerala have done, Andhra Pradesh has done, Odisha has done, Bangalore to some extent has done, and Karnataka has done fairly well too, and Punjab to some extent has done. So, therefore, you are seeing a very different response. The testing actually becomes much more relevant when the society is opening up, not so much when the society is fully locked up in the house. Particularly because this is a peculiar virus which seems to be capable of infecting in the pre-symptomatic period and possibly even in the asymptomatic people. So you have to trace the contacts and isolate them on suspicion. If you don't do that, you are going to have a lot of people with the potential for infecting others in free movement.
You mentioned asymptomatic patients, and that is another important factor, in all of this. According to some estimates, like those made by, say, the CDC, they say 1/3 patients seem to be asymptomatic. How much is that a concern, and what have we learned, during this period about to what degree asymptomatic patients can spread the virus?
Well, this virus has been teaching us lots of new things. For example, the SARS-CoV-1 virus, which was responsible for SARS, was essentially a respiratory virus which confined itself to the respiratory tract and the lungs, and mostly in the lungs where the pneumonia was severe. But this virus not only occupies the nose, throat, the sinuses, and the lungs, but it spreads into the bloodstream. But importantly, unlike the other SARS virus, this seems to be capable of discharging itself and infecting others even in the pre-symptomatic period, which could be a few days before the infection turns up. It could be even in a person who is either asymptomatic or so mildly symptomatic that the person doesn't think he or she has symptoms. So this is a much more dangerous virus from the point of view of its capacity to spread. But that brings in the whole issue of public health measures. You may not be able to trace the contacts of an asymptomatic person whom you are not diagnosed, but people can protect themselves by wearing masks, by practicing hand hygiene, and maintaining physical distance to the extent possible. Since you do not know who poses danger in the open street, you have to maintain that level of protection, assuming that everybody can potentially pose danger, including yourself, because you do not know. You may be an asymptomatic carrier yourself.
Okay, so talking about how the virus spreads, the thing that has been making a lot of news is whether or not the virus is airborne, whether or not it spreads just by droplets in the air, but even by smaller particles. And that is a claim that some 239 scientists from 32 countries are making, and they want WHO to revise their recommendations regarding this. So, what do we know about how the virus spreads through the air, and how is this new claim about it being airborne different from what we know?
Well, one thing we know for sure is that the virus does spread through droplet infection. And when a person coughs or sneezes, or even speaks very loudly or sings very loudly, droplets could be discharged carrying the virus and could land on another person or an object. And that's why the idea of masks and physical distancing has been emphasized. Whether actually there is also a spread through small aerosols being formed and being carried by the air or being suspended in the air for quite some time, particularly in closed rooms, is something that has been debated for long. However, recently there is an opinion crystallizing that it is possible that aerosols could form, though the main route of infection appears to be the droplets. But if aerosols do form, and particularly in closed rooms where they could be hanging around, obviously the need for masks continues. The physical distancing itself may not be adequately protected, though that does protect against the main form, which is the droplet infection. But in an indoor space where you are fairly confined, and if the virus is hanging around in the form of aerosols, then the protection is going to be somewhat more limited. But even there, the masks are likely to be protected. We generally advocate that if there are people without any COVID infection living in a house, masks need not be worn over there. Only when you go out, you have to wear the masks. But if you're working in the confines of a closed space and you are at the risk of having a virus which might have been left hanging for some hours in an aerosol, then it is prudent to wear the mask even in that environment, which could be an office or a school. But at home, where there is nobody who has that COVID infection, it is not really necessary to wear a mask. So we have to proceed on the assumption that we are at risk of the virus either being transmitted through a droplet or even possibly through an aerosol, which is still not seen as the main form of transmission, but take the precaution of wearing the mask wherever such a risk exists.
So, if this were to be true, and if we were to move ahead with the assumption that it might be a possibility, how much does that change things?
Well, one of the important lessons is to try and avoid crowds in closed spaces. And if you have to be there, make sure that you're wearing a mask. Because, for example, in bars in South Korea or even bars elsewhere, it has been seen, or also in places of entertainment, that if people are crowding together without masks, even assuming that they're totally asymptomatic, it is possible that if somebody has discharged viruses while shouting loudly or singing loudly or even perchance coughing, then that, if it hangs around without the air actually drifting the virus away to a free flow, then you might be at the risk of getting the virus infecting you. So the importance of avoiding crowds in closed, confined spaces remains paramount, because unlike in an open space where the air currents will definitely transfer the virus away and will prevent aerosols from forming, in closed spaces there is a greater risk of the aerosols forming. But even if you have to be there, make sure you're wearing a mask.
And we were talking about, the new things that we've learned about the virus. What new things have we learned about, the kind of damage that the virus can cause to the body? You mentioned that, unlike other coronaviruses, it can be in our bloodstream. And now there's some scientists saying that, this is a virus that can cross the blood-brain barrier, and we are seeing some patients are seeing neurological symptoms. What have we learned about the damage that this virus can cause?
Well, we know fully well that this particular virus seems to be capable of crossing all barriers and boundaries in the body and infecting virtually every single organ in the body. We know that it can actually affect also the heart. We know that it can affect the olfactory bulb, which is from the nose to the area in the brain where the smell is perceived. And apart from crossing the blood brain barrier, possibly, even from the olfactory bulb, it can start infecting the brain. It is capable of infecting virtually every single organ in the body. There is what's called a multi system inflammation. It is excreted through the stool. So we know that, therefore, the gastrointestinal tract is also affected. And we know that there are ACE2 receptors in different parts of the body, especially in the blood vessels. And therefore, virus has an avidity to go and attack the blood vessels. And wherever the endothelium is damaged, it takes the precedence there and starts spreading. Therefore, every part of the body is supplied by blood. Therefore, this can go and affect every part of the body, therefore. But it also has a greater power to reside in the testis in the males, because the concentration of ACE2 receptors is very high. And therefore, that could be a nidus from where it can keep discharging itself into the body. So we recognize that this particular virus is not only a frequent traveler across the world, but within the human body itself, it seems to take up residence almost everywhere, wherever it can.
So what remain, sort of the biggest unknowns about the virus right now?
Well, as far as the virus is concerned, we do not know whether it is mutating to a more virulent form or a less virulent form. Different strains of the virus have been described, and some structural changes on the surface have been described. But whether the structural changes actually are representative of a change in the behavior in terms of actual virulence is not clear. And it is now stated by WHO as well as ICMR that proof of any of these mutations, minor structural changes on the surface, resulting in fundamental changes in the virulence, that evidence is not available. So we'll have to wait and see. But the other element that is not known actually about the virus is whether this particular virus can actually, as I said, apart from mutating to a more virulent form or a milder form, how long it can actually reside in the body and what kind of immunity is developed in order to expel it effectively. We know that even dead viruses are continue to reside in the body and are giving false positive RT-PCR tests, confusing everybody when a person seems to have recovered, but yet the RT-PCR comes repeatedly positive. But we also know that the antibodies that are being developed, we do not know how long they will last and at what levels they confer immunity. And whether they confer immunity at all is not known yet. though passive antibody infusions are being tried out, whether cell-mediated immunity, which is the other component of immunity, immunity has two Gemini twins, antibody-mediated immunity and cell-mediated immunity. Whether that component is much more important, and we are not measuring that, that is not really known. So some of these things are still unknowns for us.
Dear listeners, sorry for this interruption, but before we move on to the rest of the show, I just wanted your quick attention. One of the big reasons people say they like this show is because it helps them understand the news better. It provides them with the context they need to see the bigger picture. And there is perhaps no other place that does that better than Indian Express's Explained section. We on Three Things refer to the section regularly, and it helps us make this show. If you're a regular reader of Indian Express, you know how useful the explained section can be, especially when you're looking for in-depth analysis by the right experts. You can log on to indianexpress.com/explained and access the coverage 24/7. Explained by Indian Express, where news that matters is explained by experts who know the subject. Now, back to the show. You mentioned briefly about, sort of, measures people can take, basic hygiene, social distancing. Now that, we are seeing norms being relaxed, people, I mean, on one hand, they are being forced to, go out and work again because, apart from a health crisis, there's also a deep economic crisis going on. And on the other hand, you also see, now people, I suppose, are getting a bit complacent, in the sense that, it has been a while, people have been quarantined, and you are seeing people on the roads just going out of their homes and not wearing masks. And when it comes to the practicality of things, of now that people are going out, what are the kind of things that they can take precautions against, the kind of measures they can take, and the kind of things that people don't normally think about that they should be doing?
I would like to sum it up in three words: care, caution, and confidence. Care is that you have to take personal care, you have to wear a mask, you have to preferably even protect your eyes because the virus can enter the eyes, and through the nasolacrimal duct which connects the eyes to the nose, it can actually come into the nose and into the respiratory tract. If you're wearing specs, fine. Otherwise, wear a face shield if you can, but at least try and protect the nose, the eyes, and the mouth. These are the three portals through which the virus enters the body. Then try and maintain physical distancing to the extent practically possible, because it's not always easy to do that. But even if you can actually practice hand hygiene and mask wearing, you get about 60% protection according to most estimates. But also avoid large crowds, avoid indoor places as much as possible, avoid spending too much time with one person for a long time, because the shorter the time of exposure, the less the number of people you're exposed to. And if you're in an open space rather than in a crowded space, these are likely to be much more protected. So these are the precautions that you ought to be able to take, which is also the caution element, apart from the personal care element. And third is confidence. I don't think we should be so cowed down by the virus that we completely get paralyzed by fear and stop doing everything. We ought to be able to resume some of our economic activities and some of our social engagement with near and dear, but with adequate precautions. And that is the way to function, at least for the next 1 year. But this element of care and caution still are very paramount.
And are there any precautions that people can take even while they're quarantining at home? Like earlier on, we saw that we were to be wary of surfaces, we need to clean them down. Those measures people still need to follow. And also, in terms of, people are getting a lot of packets delivered, food delivered. What are the kind of precautions they can follow in that sense?
Well, now it is thought that the risk from contaminated surfaces is extremely low. But we are also recognizing that the influenza season is also coming up. There is no harm in trying to clean the surfaces if you feel that there has been some droplet spread on them. But essentially, most surfaces do not retain this particular virus for long. And certainly, foodstuffs, particularly fruit and vegetables and others, which are necessary for building up your innate immunity, are things that you ought to consume without much fear after washing with water. So I think the greater fear is of getting the virus into your respiratory tract, either by direct droplet falling on your face or because your hands have transferred from the droplet infection into your face. So if you wash your hands frequently and if you wear your mask frequently, at least outside the house, the likelihood of acquiring the infection is low, and surfaces by themselves do not pose that much of a problem.
Also, where is the current situation headed? Where do we see this pandemic headed, say, in the next 2 months?
Recently, I was listening to a podcast of a US expert who said, call me back after 2 weeks. I may have to revise some of the statements I'm making now. So actually, most people still don't know exactly what is happening, and it's probably not correct to make too many forecasts with too much of confidence about this virus, which actually fools everybody. But having said that, it appears that at least in the larger cities, if we take adequate public health measures, we should be able to control it within the next 6 to 8 weeks. But the real challenge is to prevent it from spreading to areas which are not currently much affected, like the smaller towns and particularly the rural areas and much of eastern India, which has been unaffected. So that is where the real challenge is going to lie. And we have to try and see that India as a whole wins the battle and not only in parts of big cities.
Dr. Reddy, I was just wondering. I mean, you mentioned that what we learn about the virus keeps changing, right? Like in this conversation, what we're having might be very different in 2 weeks, even in 1 week, perhaps. So, how much of a problem is the information that is brought out about it, and how confusing things can get sometimes? How much of a problem is the sort of confused messaging when it comes to the virus?
I think there has been a fair amount of confused messaging because the evidence was being interpreted essentially from the West, and they were basing the messaging on their experiences. And therefore, they said masks are not important. But we have seen in Southeast Asia and East Asia, masks have traditionally been very protective, and now everybody says you must wear masks. So I think discounting the experiential wisdom of other parts of the world is a folly, and we should not depend only on Western wisdom for this. But secondly, we must also learn to recognize that there is a lot of misinformation flowing out also on the social media, a lot of claims and counterclaims being made, even by scientists, and that can be problematic. So I think for us to try and sift the evidence as it comes in and find out what is valid and what is relevant is both important. To be open minded about new information, but to be also shielded against misinformation is going to be critical as we move along. And I think agencies internationally are recognizing that, including the WHO.
Is there any country and the strategies that they have used that we can actually learn from?
Well, there are countries, for example, I mean, South Korea is very frequently cited as a model, but they could manage because of the small population, but with extensive testing, which was available because of their local resources. And the population was very adherent to whatever public health advice that was given. But I think the real hero of the story is Vietnam. Vietnam is managed without deaths. It is managed with a remarkable level of control and with not a very high level of testing either. That's because they clamped down and used the period of lockdown for extensive contact tracing of every single case up to the fourth degree of contact. And then they isolated them. So I think in terms of public health strategies, if every district in India had become a Vietnam-like model, then we could have done very well even during the first two periods of the lockdown and the immediate aftermath of the release. Some states have done it, like Kerala has done it. To some extent, Andhra and Orissa have done it. So I believe we have a lot to learn from our Southeast Asian closer neighbors than from the West.
And Dr. Reddy, how do we? I mean, maybe this is too early a question to ask. How do we see this entire thing ending? Do we have a sense of that?
Basically, this whole thing can end by three ways. One is we get a very effective and safe vaccine, which can be used across the world to protect at least the highly vulnerable sections. Second, we can get herd immunity. And third, the virus itself can change its character and become less virulent. The vaccine seems to be at least a few months away, if not a year away. and we do not know at what volume and at what price it will be produced and be available to the whole world. Herd immunity is unlikely to happen soon because you require at least about 70% of the entire population to be exposed to the virus and become immune, for the remaining 30% to be protected. And for 70% of all of India to be infected by this virus is going to take a long time, because so far, possibly only about 5 to 7% of the urban population has been infected, and less than 1% of the districts have been found to be infected by the ICMR study. Even abroad, the overall national exposure rates have been only 5 to 10% in most countries, not even 10% in most cases. So to reach that magical figure of 70% for all of India is going to be extraordinarily difficult. It's going to take a long time. The vaccine, as I said, is going to be somewhat away. We'll have to hope that it will be available quickly and on a scale that a good deal of our population can be immunized with a safe and efficacious vaccine. On the other hand, there is also the possibility of the virus becoming less virulent. And this is where I believe evolutionary biology comes into play. The viruses which are relatively quiet while residing in the wild animals in the forests, why do they become so virulent when they enter large captive bred animal populations or human communities who are fast travelers, and the virus hitchhikes with them and grows more virulent as it moves from population to population? It is because we are giving the virus a highway to ride and ride fast. If we create a bumpy road for the virus to travel by all the physical distancing measures, wearing masks, and all the other methods which reduce the transmission speed of the virus, then the virus will likely, by evolutionary biology, mutate to a less virulent form, because if the host is limited for its transmission, it cannot afford to exhaust that host if its own species has to survive. That's why in the wild animals, it is really not causing so many deaths. It is causing deaths in the captive veterinary animals and in humans. Maybe we can reverse the process. It's known that you can actually get the viruses to mutate to less virulent levels. So our physical distancing, masks, etc., are all methods by which we are not only protecting ourselves at the present, but by forcing the virus into a corner where it has very little of host community available for its own spread, it will possibly change its character. These are somewhat speculative, but all of these factors could actually play a role in bringing an end to the epidemic.
So, based on what you're saying, one of the things that I suppose will happen is that cases in India will continue to rise for a while then.
Yes, for a while, but how long we do not know. Partly it's because we know fully well that with increased testing, and we are also using different types of tests now, antigen tests as well as RT-PCR, and in some cases the antibody tests, which are meant only for serosurveillance in terms of epidemiology, are also being used sometimes for individual testing. Because of the multitude of tests and the rising test numbers, you're going to see more cases reported. But I think what matters is, when are the cases coming down as new cases, as a fraction of the new tests being performed, with standardization of the type of tests. The second, more important, I believe, as an indicator, is when the daily death count starts coming down. Because since there are a lot of variables affecting the testing numbers and the results, the deaths, at least if we can ascertain them well, both in the hospitalized and non-hospitalized cases who have died, there, if the daily death count starts coming down steadily over 10 days, we can say that we are seeing the back of the epidemic.
You were listening to Three Things by the Indian Express. Today's show, as always, was edited and mixed by our producer, Joshua Thomas. Before we go, here's another reminder to check out Indian Express's Explain page. You can log on to indianexpress.com/explain and find in-depth analysis by the right experts. It has everything you need to know to understand the news better and see the bigger picture. If you like this show, then you can subscribe to us wherever you get your podcasts. You can also recommend the show to someone you think will like it, share it with a friend or someone in your family. It's the best way for people to get to know about us. You can also tweet us at Express Audio and write to us at podcast@indianexpress.com.